A very good morning to you. Thank you so much for keeping it Alpha G only on K24. Shiko Kaitani is my name, and welcome to another edition of Wellness Wednesdays. Continue to interact with us through our social media platforms at K24 TV on Instagram, Facebook, as well as Twitter. And if you prefer to SMS, well, 21222 is that SMS number. Please begin your text message with Alpha Jiri. Now, November is actually Men's Health Awareness Month, and for the past 2 days, gentlemen, we really have been celebrating you by encouraging you to improve your health and your wellness. And that actually means self-care, seeking regular medical advice, and early treatment. Now, on Monday, we actually talked about men's grooming, and yesterday, we did highlight one of the top killers, which is prostate cancer. Now, today, we bring you a topic that may be slightly uncomfortable, but you know what they say, someone's got to do it. And this time around, we are going to be discussing male sexual dysfunction, in particular, erectile dysfunction. Now, believe it or not, your performance down there may be a sign of bigger health issues and is actually linked to your nutrition and fitness. And so today, we are really happy to have urologist Dr. Sam Kagiri from Kenyatta National Hospital. We also do have fitness coach Gideon Onoka. Gideon has actually trained the likes of Maina Kageni, Shafi Weru, as well as Sanaipe Tande. So he's worked with the best of them. So gentlemen, welcome.
Thank you for having me.
Okay, so we're going to start off with a description from you, Doc, and that's explaining what ED is.
Erectile dysfunction is one of the least, or so to say, little understood conversations by men. But in medical terms, you describe it as the inability either to attain or sustain a normal erection adequate enough for a good sexual performance, so to say.
Right.
So in a nutshell, that's actually what erectile dysfunction, the definition of erectile dysfunction is.
I would have to say you're very, very bold for actually even specializing in urology, because you wouldn't find too many of them in town.
No, men do need help.
Yes.
And men, I mean, from old age, health-seeking behavior of men is very different.
Right.
And we're talking about critical issues, so to say, critical equipment that's necessary for a man's well-being, necessary for a man's ego, necessary for a man's just general feel of self-satisfaction and satisfaction in society, actually.
Okay. Well, listen to this. World Health Organization studies show that men are much less informed about their health needs than women are, and are more reluctant to see a physician. In your opinion, do you have trouble actually getting men to the clinic for such conditions?
Surprisingly, yes, that is true. That is partly true. But it's mainly based on the health-seeking behavior of men.
Yeah.
Men usually are not as comfortable talking about their private issues, and especially when it comes to performance issues in bed, performance issues about their sexual equipment, the penis, the testes, and all that. And you'll find just the design of nature. Women talk to each other about their issues. They talk to each other about their medical issues, their internal issues, not only physical, but even the emotional issues, the psychological issues.
Yes.
It's very hard to find men on a round table discussing their penis or discussing their testes and saying, oh, mine functions, mine doesn't function. Very difficult.
Right.
So, yes, it is difficult to find men coming in on a daily basis to say that. But when they're driven by organized information, or when they're driven by information that is relevant to them, they do come.
Okay.
They do come and they give us that information.
What about the causes, before we can actually rope Gideon in, the causes of ED?
Okay. There are various causes of ED. And just even without delving fast into the causes, it's also important to understand the normal, what the normal is. And I brought a model with me just to be able to describe what the normal would be. The function of the penis, or the function of erection, is not just a one-state function. It's a variety of things, a variety of tissues, a variety of hormones, a variety of chemicals that are working in the body in concert to bring about this thing we're calling erection. And just for purposes of describing through this model, we have a model of the male pelvis. Okay? And if we look here at this point, this is the area of discussion we're talking about. This is what is called external genitalia. This is what we can see.
Right.
But inside, there are a lot of other things that are that we may not really see from outside, but they do work in concert to bring about the function of this part of the body.
Right.
And this is the male pelvis. So we are talking about the tissues that are the vascular tissues. And if you look at this point here, these are the tubes that collect the blood. Yeah. For you to be able to attain an erection. They don't just collect blood like that. There are hormones working in concert. Right. There are nerves working in concert to bring about that collection of blood inside these tubes so that they could be raised and form an erection. Yes. And there are also other tissues. Yes. Talk about the brain tissue that is a main central system for the nervous system. We are talking about the blood. Yes. We are talking about various other factors. So understanding the normal is not a one point kind of situation. It's actually many factors coming together for you to attain an erection. Right. So various factors, yes, do result into erectile dysfunction. Okay. And they've been classified as either from the vessels, from the nerves, from the hormones. Either it is structural or anatomical issues with the anatomy. Yeah. Are they because of surgery? Are they because of trauma? There are various factors. There are various factors. Yes, they do. Gideon, karibu sana to the show yet again. Okay, so let's talk a little bit about fitness in this particular situation, and maybe you can start by telling us some of the mistakes that men make in terms of their fitness routine that could even be causing ED.
Yeah. Basically, there's a lot of things that people are doing wrong. Yes. There's a myth that when you train too hard, now you will achieve what you want in terms of ED. Yeah. But that is a very wrong concept, because number one, the only thing that you're supposed to consider as well, you need to have a proper advice on what to do at the right time. Yeah. So the lifestyle is a big problem. You get people living a very wrong lifestyle in terms of even what they're eating, the outing they're going, and all the foods you're doing right now in Kenya, you get 40 to 50% artificial. Yeah. So now all this problem is, the doctor said, it depends on what causes the problem in every human being. So the wrongdoing is sometimes you become so inconsistent in training, which can help boost your immune system, boost your we call it testosterone. Yeah. Testosterone muscles is the one, hormone in men, is the one that's supposed to boost the libido, which will help you when it comes to performance and when it comes to maintaining your ED. Yeah. Now, because we want to call it a bit in a good way. So in the reality, basically, that is the only thing that I think is going wrong, and it's going viral too fast, especially in youth. Yeah. Yes.
There's that myth, by the way, just to rope in terms of fitness, that bodybuilders actually do suffer from ED. Is that really true, though?
I will not say it's true or wrong, but the reality is 40 to 50% it's yes. Yeah. Because this is the problem now. I'll bring in a point of artificial hormones. Yeah. You see, right now young men go to the gym. Tomorrow they want to buff up. And before they buff up, they run to the solution, which is a very quick solution. This quick solution will result for you to buy the steroids or for you to buy the supplementation. Right. Now, this supplementation, before you buy them, you're supposed to be advised by the doctor. Right. Because not everyone is allowed to use supplementation unless you have a problem in your body and a doctor has identified and you cannot grow them naturally. Now you're advised to go and take supplementation, and which kind of supplementation. Yeah. Now, when it comes to these people, they go take the short-term goal, which is a supplement, maybe for lack of a good word, they just buy it for 2-3 days, a show off. Yeah. And then after that, they run to steroids. Now, the repercussion of steroids is when you inject the external hormone in your body, it suppresses the normal hormones that your body is supposed to produce. Right. Now, when it suppresses that, your body is not in a position to produce whatever it normally does. Now, it shuts off. Yeah. Now, these artificial hormones, you will run on them for a while. Let me say maximum 1-2 years, right? Yeah. Now, the repercussion will start. As well, a doctor can testify, it will crash the whole system. Now, after you've gotten used to those kind of steroids, now what happens is you will not perform anymore. Now you will start depending on over-the-counter
solutions,
medications. And now this again will take you short while. After a short while, you run into depression because your body is not now coordinating because you've been pushing it to become to what you want, whereby what you want is so different.
It's not natural.
You see, and this myth of I'll get a lady, I'll take 1 hour or 2 hours. I want as well a doctor to be, at least to go deeper into it. That is what is running men and young boys actually right now into a problem of trying to impress a lady, not knowing what you're causing to your own health.
And, you know, even just to build on what Gideon is actually saying, Doc, you know, when you actually talk to men, probably in their 20s, 30s, you can see that, and, you know, correct me if I'm wrong, but a man's sort of self-esteem is kind of tied to how well he is able to attract and more or less impress a woman, so to speak. And if he's not able to perform in that particular area, it really does crush their self-esteem.
Definitely. Actually, if you look at the broad causes of erectile dysfunction, there's some of them that are psychogenic. They're related to what you feel about yourself, your self-image, what you think about yourself, what your partner thinks of you.
Right.
Yeah, it would take, like he mentioned rightly, men are getting quick fix problems where you think maybe going half an hour, 1 hour in a sexual encounter is normal. And if you go less than that, then you're abnormal, which is not necessarily medically true. I mean, they give it times of 7 to 10 minutes. And you see, these are phases that are being covered in the whole sexual cycle. There's a sexual cycle, both for male and female.
For female,
Yes. So you start with the desire, you go to the arousal phase, you get now to the excitement phase, and you get to the orgasm. And after which you get a latency period, especially in men, a period in between which, so to say, for lack of a better word, the tissues recover. And you're not able to get an erection within that period. So yes, men are affected, especially image-wise. You'd hear men in social places talking about, yes, mimi ndio ndume, mimi ndio naenda 5 hours, 2 hours.
Yes, and you're like, that doesn't even make sense.
Medical. And again, the information they get most often are from social setups, and you'll find men don't comment. When they hear somebody else has said, oh, may I go for 2 hours? And at the back of your mind, you know, you just do 10 minutes, then you don't give a comment in that scenario.
That's true.
Again, Dr. Google has
spoiled quite a bit. Dr.
Of course,
Google.
with the advent of everybody having a smartphone, there's pornography, and people watch it with or without restriction, and they get the wrong conception. They get the wrong concept from those things. They get the idea that if I don't perform this way, then
there's something wrong.
There's something wrong.
And there is nothing wrong, by the way.
Nothing wrong,
wow. Okay, that's really a good point, and I'm glad you actually mentioned that. We can talk a little bit about what ED probably is a sign of. Can you actually tie bigger health issues to ED? Yesterday, we talked a little bit about prostate cancer. That's just one that was actually mentioned, that if you do have ED being a sign of prostate cancer, but maybe you can expound a little bit more as to some of the bigger health issues that maybe men are facing having ED.
Well, one of the biggest health issues I'd say that is probably ED can be appointed to, believe it or not, is the state of the health of your heart.
Wow. Okay.
Yes. Okay. Recently, in the recent past, there's a consensus called the Princeton consensus, and they actually talk about the benefit of sexual activity and good cardiac health. And in one of those, in the discussions, you'll get to the information that actually the health of your penis, erectile dysfunction can actually be a pointer to abnormal health of the heart. Because the risk factors are almost similar. If you look at the things that affect the vessels, they'll affect both the vessels of the heart and the vessels of the penis. You look at smoking, you look at non-communicable diseases, we talk about hypertension, we talk about diabetes, especially poorly controlled. Diabetes, poorly controlled, hypertension. We talk about cholesterol issues, we talk about states where you talk about metabolic syndromes, where you have elevated lipid levels, and there are various factors in the body that do affect both the penis and the heart. And some studies have actually shown that when a man, especially an elderly man, and I'm talking about the young men, of course it's also good to screen them for other diseases that would be a risk to them. But if they do come to you, you're looking at their weight, you're looking at their body mass index, and you're looking at their pressure, you look at their whole metabolic state, and they present with erectile dysfunction. The story doesn't end there.
There's something more behind.
Actually, they need to have a cardiac review, and you actually check the state of the heart.
Wow.
Yes.
Okay. How does fitness then come in? Because we talk a lot about fitness, we talk about nutrition then, Gideon. How does this prevent you being physically active? At least, you know, getting you to at least avoid getting into such a situation or coming across this condition? Okay,
now, fitness will never correct your ED.
To begin with, number one. Yeah.
Because, you know, sometimes it's good to tell people the reality. Yeah. Out here, there's a myth. And that's why I said you get people doing or overworking for the sake of gaining something which they knew they've done a mistake. Now, the reality with fitness is this. Your body needs circulation. And all about the erectile thing, it's about the blood flow. Now, if that blood flow is not okay, you need to send that. You need to actually understand the client first. If this client, the problem is ED, what is the cause? Before I start training you or before you start coming to the gym for that solution to get of the same issue, now I'll send you back to the doctor so that it can be defined. To what level have you messed up yourself? Can it be corrected? If it can't be corrected, the doctor will be in a position to advise. Problem is this: you come to the gym today, you run 1,000 times. Every time you're doing like 100 minutes, morning 20, evening 20, you know, you'll do all those minutes, no problem. But what is the major cause? Maybe sometimes you've teared away some muscles, you've teared away some vessels.
Which is what you were talking about,
which are so important. Now, where does it help if you've not teared some vessels? As I told you, the whole thing is about circulation. And maybe in your body, you may have a wrong circulation system. When you start working out, the whole thing that becomes the norm of you, it is the body now starts sensing there is something active that is happening, whereby I need to adapt to this, which is the best. And when it starts like that, your heart is in good condition, which is coming to a cardiovascular. It is okay. Now, when the circulation becomes better and everything else in your body is okay, this is PAP. You see, so it depends. It is not just like I run to the gym and get back my routine and everything will be okay. Depends with the source.
It depends with the source. So, but what we are saying is prevention is better.
Yes, prevention is better.
You can prevent it by a healthy lifestyle.
Yes, you prevent it by a healthy lifestyle. And you see, let's go back a bit to the source as well.
Yes.
Everyone right now, there's a sort of ego, especially in men. And this ego, it comes all the way from the Mr. Google. This Mr. Google comes all the way, you read and you understand, and you go to your, don't try to run away. Even ladies, they are participating in this one too much. So, because if you look at whatever they're watching, and they want their men to perform like that, not knowing even what has been shared in the pornography page, it is only 2 minutes of an action.
I like that. I like that. Yeah, that's the reality.
2 minutes of an action. But now they get weighed off with that, and they think that is the best thing that's supposed to happen home. So now this person is going to have the same thing with, she has already a negative mind that she's expecting Gideon to perform like so-and-so, which when it comes to a realistic life, you are not artificial. You're a human being who's supposed to generate everything to the norm. So please, everyone, the best way to do it, if you think you've been affected, seek advice from the doctor. If you think you've not been affected on this one, try maintain it with fitness. Because fitness will help you not even accumulate the extra cholesterols that will help you to do the important things in your life.
Absolutely. Okay. So even as we talk a little bit about exercise, maybe you will suggest how people can actually stay healthy, you know, like you talked about, get that heart pumping and that blood flowing, just to, you know, encourage, of course, a healthy lifestyle. Let's talk a little bit about the ladies at this particular time, Doc. And of course, Gidi, you can actually jump in. We only have a couple of more minutes. But how can women participate in this? Because if you have noticed that probably your man or that, you know, that person that you love probably does have a condition that he's dealing with. As women, how can we play a role in this, in encouraging our men to actually seek medical help as opposed to discussing it with other ladies?
I think I'd narrow down to one word.
Okay.
Be empathetic. Be very considerate and be very open. Imagine what you would feel if, I mean, flip the situation. A man would come in front of you and you're in the most vulnerable, and he tells you, and probably you just about to have a sexual encounter, and he tells you, hiyo ngozi yako inakaa mbaya. Haikai kama ya ule mwingine. Ama hiyo nywele yako inakaa mbaya. Ama, you see, you're most vulnerable. Yes. That will affect you psychologically. And it might not even start from there. And you'll see some psychogenic elements of erectile dysfunction, even in men, are partner-based. Yes. Some of them are situational. Some of them even lead to things called performance anxiety. So for women, be very considerate. Yes. Words are very powerful. What you tell your man at his most vulnerable, those things are very powerful. Okay.
Gideon, as we wind up, because we actually need to take a short commercial break, gentlemen, over-the-counter solutions. The Viagras, nguve za kiume, that we see in the dailies every single day. What are you going to tell the gentlemen about that?
And all those
yes.
There's no magic pill solution.
Okay.
Yeah. There's a pill that will work for somebody. There's something else that counseling will do. And they don't even need a pill. Yeah. So get the proper information. Get the proper information from a medical practitioner or somebody who's knowledgeable in this information. Don't Google it. Don't talk to your friends. Don't exchange medicine. Yeah. What is good for you might not necessarily be good for somebody else. And the causes are various.
Okay, Gideon, what do you have to say quickly?
Yeah, I'll quickly jump in on the first point that you're trying to leave me out about the ladies. A lady is the one who can make that man feel he's important. Yes. Very important. It does not matter. Even that person, if he's not satisfying, there's a point you guys can sit down and talk about it, and that guy will feel like he's okay, and he can help himself to recover from the problem. Yes. But all the time, if you're trying to suppress him and show him he can't do it because Gideon did it better than you, then it's better you stay with Gideon. But if you want to make this person becomes better, you need to adapt that situation and try and make sure this person learns all the way and he can recover psychologically, even without medication. Okay. Number two, quickly, the solve it quickly. Yes. Solve it quickly issues. You go to the hospital, to the counter, someone gives you medication, you use it in 2 minutes, it's done. What is happening, I'll explain a bit. What is happening is your tube, your tube that it's supporting, that's circulating the blood. It is like this, let me assume. Now, when you take that medication, the pumping that comes enlarged your tube to this level. Now, tomorrow, after you've enlarged this tube to this level, you take 2 medication, right, to help maintain that tube, right? The other day, how many will you take? 10 to maintain that. And now, at some point, you'll get used to that. Nothing will function. So please, there's no issue about solving it very
All right, no quick solution. Thank you so much, gentlemen. We do have Dr. Sam Kagiri in studio, urologist, talking to us about male sexual dysfunction. And of course, a big thank you to fitness coach Gideon Onoka. Like we said earlier on, actually this could be tied to bigger health issues and of course is linked to nutrition and fitness. And right now we're going to take a short commercial break and come back and talk a little bit about nutrition in regards to male sexual dysfunction. Keep it Alpha J.